Let us talk in brief about what is radiation therapy. Almost all patients who are suffering from cancer does need radiation therapy at some point during their treatment journey. What is radiation? Radiation is X-rays. These are rays, the same rays which are used to diagnose, used in the CT scans. The same X-rays are used to treat cancer. These are a slightly higher voltage X-rays. Now, these X-rays are used to treat cancer with the help of a machine called linear accelerator. So, most of the radiation machines which we have in India and abroad are CT-based linear accelerators. We have MRI-based linear accelerators too, but about this we are going to talk sometime later. Let us talk about the common linear accelerators which we have. When a patient has been planned for radiation therapy, this radiation therapy can be of two intents. One is a radical or a curative intent. Second is a palliative intent, which is given for an advanced stage disease. But whatever the intent is, the method of treatment is the same. So how do we treat with radiation treatment? When a patient is planned for radiation treatment, we cannot deliver the radiation immediately. A proper planning needs to be done. Why? Because these days the radiation is targeted. It is precise. The aim is to see that the radiation hits only the area which has the tumor cells or the areas which we want to target as doctors. All the normal areas around has to be saved and has to be protected. Why? Because all the toxicities or the side effects of radiation treatment occur because of the dose which reach the normal organs. So, if we can give a precise radiation dose to the target and protect all the normal areas around, then we can reduce the side effects to the patients. Also, when we reduce the side effects to the patients and when we can protect the normal areas, then we can deliver a higher dose to the target areas. And in doing so, the chances of cure are much better and the toxicity is less and the quality of life of the patient is much better. Fortunately, we have all these methods in our country in most of the hospitals. So when a patient comes for radiation treatment, it is done in steps. The first step is that counseling the patient. We sit with the patient, read all the papers which the patient has, understand the disease of the patient, understand the biology of the tumor, understand all the scans, the MRI, the PET scans, the CT scans, and also the histopathology of the patient. And we need to also examine the patient well. And once the patient has been studied well, the disease has been understood well, and then the radiation planning begins. So, the second step is the radiation planning, which is done a few days after the first counseling. So, the day the patient is called for radiation planning, we tell the patient that it will require about 1 or 2 hours in the hospital. This is the time when we call the patient. The patient lies on a simulator. A simulator is a machine which looks like the treatment machine. It is on this machine that we take the image of the patient in the treatment position. The patient is made to lie on the simulator machine wearing a mask. What is a mask? A mask or a cast is made proportionate to the patient's body, the part where we want to treat the patient. Like if the patient is being treated for a pelvic cancer, then the cast is made of the pelvis. If the treatment is for the head and neck area, the mask is made for the head and neck. This mask the patient wears during the treatment. The purpose of the mask is that the patient does not move during the treatment. As I said, we are planning for very precise radiation treatment. So when precision is important, it is also important that the patient does not move, and hence the mask is made. There is many times the patient asks that is the mask to see that the radiation does not go to other areas? No, the purpose of the cast is only to immobilize the patient during the treatment. So the second step is the simulation scan and the cast, and after that the patient goes home. We need 2 to 3 days time in our department when we plan the treatment. This 2 to 3 days time we do not need the patient, and in this time we take help from the patient's scans, the histopathology report, from all the examination findings which we have, and we prepare a plan for the patient. Generally 3-4 plans are prepared and the doctor chooses the best plan. Which is the best plan? The best plan is that plan where the normal areas can be protected maximum and the maximum dose can be delivered to the target area. So after a good plan is made, we call the patient. So the patient comes after 2 to 3 days, and this is the fourth step of the treatment, where the patient is called to the OPD, and before beginning the treatment we tell the patient, we counsel the patient once again about how the treatment is going to run. We explain to the patient once again how the patient will feel on the treatment table and what kind of toxicities or side effects little bit the patient can expect, and then the treatment is begun. Once the treatment is on, so this may be for about 3 weeks, 4 weeks, 5 weeks, depending on the plan which has been made for the patient and the site which has to be treated. During the course of the treatment, the patient is seen in the OPD at least once a week to see the skin reactions, to see how the patient feels, and also to see the blood counts. At the end of the treatment, the patient is given a discharge summary in which all the treatment details are written, and this treatment detail the patient can refer to in the future if he needs for any other purpose. After the treatment is over, the follow-up is very, very important. We ask the patients to follow up with us regularly at a particular period of time. The purpose is to see how the radiation reactions have recovered, if the patient has any new symptoms, and also to see if the cancer has not come back. So this is in short how a radiation treatment is planned. We will have more videos to talk about the radiation treatment in detail, every step in detail. Thank you.